To Artist in Recovery / Darryl P. from Weaver, John C. of Roseman, California. You know the schmuck that does the Diary of a Griever named John Weaver out here in Roseman, California. How you doing? Yeah, it's Friday the 8th of May. It's 15 before 11 o'clock in the morning. Caught the video concerning about your spider bites. Are you acting big and brave or really stupid about the situation? I almost lost a mother to brown recluse. She developed staph. You know what staph is? Shall I educate you and the public? Staph infection? Staphylococcus, or I want to get that right pronunciation of this shit. It's called staph infection, but this stuff is a bacterial nightmare. Now they've got some websites out there that will educate you about staph infections. I'm looking at clevelandclinic.org. Staph infections happen when Staphylococcus. It's a mouthful. That's why they call it staph. The bacteria gets into the skin or other parts of your body. It causes blisters, sores, boils. Affect your blood, heart, lungs, digestive tract, breasts, or bones. Can be easily treatable or life-threatening. And usually they're treated by antibiotics. Now the thing is, well, my mother got bit by them. She was bitten in bed. She had a brown house. Bit her in the leg. And she stayed in bed for almost a year, battling out this son of a bitch. She had to have constant viral treatments about this bastard. They can cause cellulitis. I had cellulitis in my foot. I almost had an osteomyelitis on this one, which meant infection going into the bone. And then I'll be losing the bone and the foot. Cellulitis was outside in the tissues, and therefore with a strong antibiotic regime was able to keep it down and knock it out. But this stuff can create a lot of infections. How about septicemia? Making your bloodstream toxic to you. Or gastritis, food poisoning. Gets even better. Endocarditis, when you have inflammations around the heart. And it gets into the blood vessels. Just as bad as having pericarditis, inflammation around the heart, water buildup. Or, as I said before, osteomyelitis, which is infection in the bone. Or in her case, it would have been pneumonia. My mother, thank God, didn't lose her feet. But she was fighting this son of a bitch for a long while. Symptoms: swollen, warm to the touch, red or dark compared to the surrounding skin. I had that. Painful, yep. Filled with pus or fluid. I had it. Crusty at certain inches, itchy, peeling. Yeah. But I had it on the foot. I had a diabetic ulcer, similar to this. And since I had this thing already cut open with the dead flesh gone and the healing regular flesh just trying to heal up, it was still fighting infection. I had to have a CAT scan to see what the hell was going on. They confirmed I had cellulitis. But this wasn't about a bite. This was about a diabetic ulcer. But this is similar. It's similar to that. And what you had, you could have lost your body, or part of your face anyway. Think about that one, dude. fever, muscle aches, fast heart rate, diarrhea, nausea or vomiting, shortness of breath, cough, bone or joint pain, weakness, low blood pressure. Good Lord. You'd be dying, dude. Bacteria get into the damn body through a break or opening in the skin or mucous membranes, including during surgery, or eating contaminated food, or medical devices go in your body like a central venous line or a breathing tube. Higher risk for the staph infection if you stayed in a hospital or recently had surgery. Had medical devices that entered your body. Well, they didn't have that one. Have diabetes. Vascular disease or eczema. Weakened immune system. At least in yours. Sepsis. Want to hear about that one? Life-threatening reaction to an infection in your bloodstream. Staphylococcal scalded skin syndrome. Yeah. Causes skin to peel off all over your body. Toxic shock syndrome. Life-threatening reaction to toxins in your bloodstream and organs. And they'll get your sample one way or another, either through blood or mucus or pee in a cup, or CT or echo. There's a lot of ways to do an antibiotic on your ass. The one thing they really wanted to really fight off, dude, is MRSA. You ever heard of this one? God, it's been out there for decades. This son of a bitch will kill you. I mean, it will eat you alive. Flesh-eating virus. Flesh-eating bacteria. You need a cocktail just to get rid of this son of a bitch, or try to deal with it. So, if you happen to get bit by a damn spider, get your fucking doctor to take a look at you and save your ass. Me personally, I've had a problem concerning about doctors and medical establishment, but the older I get, the more I need these sons of bitches. Not just dealing with mental illness, but dealing with a body that's failing. Changes your priorities like crazy. Some things I could try dealing with, and other things I don't. When it comes down for a staph infection, I don't fuck him around. I don't fuck around on this one, dude. And neither should you. That being said,